My name is Matt Spencer. I'm with US Poultry and Egg Association. We want to welcome everybody to today's webinar on emergency temporary standards for COVID-19. We're honored to have members from US Poultry and Egg Association, American Feed Industry Association, AFIA, and the National Turkey Federation on today's webinar. We're joined today with speakers from Con Masil Carey COVID-19 Task Force. We have Kate McMahon, Aaron Gelb, and Bita Lashkari that will speak to us today. We'll just go through a couple of housekeeping steps before we get started today. All lines and cameras have been muted for today's webinar. We ask that all questions be entered into the chat window and not into the question and answer window, but enter them in the chat window. Please feel free to enter them during the webinar. We will read the questions to the presenters at the end of their presentation today. Today's session is recorded, so if you object to a recording, we please ask that you disconnect at this time. A recording will be made available after today's event for those unable to attend today's webinar, as well as slides of the presentation will be available after today's webinar. So with that, I will turn it over to Kate to get us started today. Kate, thank you.
Thank you, Matt. Thank you very much. And thank you all on the telephone. My colleagues, Aaron Gelb and Bita Lashkari, and I are going to try to provide what we hope is a very helpful webinar about both OSHA's emergency temporary standard that they just promulgated, and also about the new guidance that OSHA has updated and issued the same day that they issued the emergency temporary standard. Just when I think everyone thought the world was getting a little better, we maybe had the pandemic a little bit in the rearview mirror, OSHA comes out with an ETS that may apply at least in part to some pieces of your facilities and to the updated guidance that surely does apply to your facilities. So no rest for the weary, but we're here to provide what we hope is an overview of the main requirements of each of those, the regulation and the guidance, and also to answer questions that you have. We don't want to spend an hour and a half just sort of talking at you. What we'd like to do is kind of run through this at a fairly aggressive clip so that we can save time to interact and dialogue with you and answer some of your questions. So why don't we get started? I am actually not seeing the slides. Is everyone else seeing the slides? Okay, all right, good. All right, well, let me use my version. I'm not going to take time out, everyone, to sort of spend time doing introductions. Let me suffice it to say, Bita, you can move on to the agenda slide. Let me suffice it to say that I've been practicing in this area for an awfully long time. My focus has been, among some other things, in the OSHA world, OSHA rulemakings. So I've been working very closely with my colleagues at Con Masil as well as others to interface and interact with OSHA related to the rulemakings, not only this one, but the upcoming permanent infectious disease standard that I hope we get a little chance to talk about. And also to provide basically, Aaron, Bita, and I 24/7 have essentially been providing compliance guidance, counseling to answer those many, many questions that kind of fall in the middle zone where the language in the regulation is not clear, there's not a clear FAQ that's been developed, and no one knows what to do. And that's been the case with the guidance throughout, and now with this emergency temporary standard. So let me begin by outlining the topics that we've identified to talk to you all about. First, I'm going to spend just a couple of minutes providing a little background on kind of how we got where we are today, because I think it's important to understand the landscape so that we can predict where we're likely to go in the future and how we can impact the direction we go. Second, we're going to spend the bulk of our time talking about first, application of the ETS to your facilities, how, when, and where that applies, and then the requirements of the ETS. Then we will talk, and Aaron Gelb, my colleague, is going to talk about this, talk about the updated guidance. When OSHA issued the ETS, as I just said, they also came out with new updated workplace guidance that applies absolutely to your facilities. So even if the ETS doesn't apply, certainly this guidance will, and not just to the medical clinic part of your facility, to the whole facility, inside and out. And then finally, we're going to wrap up with a discussion of Cal OSHA's revised emergency temporary standard. There has been a tremendous amount of activity, sort of yo-yo type activity out in California, but they've landed in a place that is certainly, from an employer's perspective, better than where they were. And we'll talk a little bit about the new relaxed guidance, requirements that Cal OSHA has established. All right. All right, how did we get here? You all know this, right? On day one of President Biden's inauguration, he issued a directive, an executive order that said that OSHA is to make a determination by March 15th as to whether an emergency standard is necessary. The agency, and we know this from our friends over there, we have dialogue with them directly and often, and we know that they got about immediately to doing this, to focusing on COVID. In fact, I don't think we can say exclusively, but certainly near exclusively, they've been focused on COVID over the last 6 months since they've been there. The first thing they did is they updated the guidance that had been issued by the Trump administration, OSHA, and that came out in January. We've been living with that guidance until a week ago when OSHA updated their guidance. In addition, they went about writing an emergency temporary standard. They made a determination that it was in fact necessary, and they developed it. They sent it over to OMB at the White House in late April 27th. They delivered the package. It was broadly applicable to all industries. It was not limited to healthcare. It would have applied directly to all of your facilities. However, the Department of Labor and the White House, I think, brought some other considerations to the table. And I think getting the economy going was a prime consideration that was moving the White House and the Department of Labor. Also, on the ground, as you all know, we were living through one of the most amazing vaccination efforts in the history of any country. We moved like lightning speed to get vaccinations out there and did so successfully. So while OSHA was writing the emergency temporary standard, literally while they were writing it, the ground was shifting under them in a good way, in a very good way. People were getting vaccinated. Now, it's uneven across the country, certainly, but the huge amounts of vaccinations, shots in arms were happening. And by the time they got done, and by the time the White House met with stakeholders, it was a very different picture. What ended up happening, as we all know, is that on June 10th, just a couple of weeks ago, OSHA issued an emergency temporary standard, but it was not broadly applicable to the world, to the nation, to every facility. It was applicable only to healthcare. However, the key for your facilities and your industry is, what does OSHA mean by healthcare? And we're going to talk about that in just a minute. The other fact that I can't not talk about when I talk about how we get here is the sea change that resulted in the CDC updated guidance issued in May. Middle of all this happening with OSHA and OMB, CDC comes out with this new guidance that basically relaxed the mask wearing requirement for everyone, not just employers, but everyone. Okay, so emergency temporary standard published on July 21st. Vita, do you want to move forward? So here's the big question, and we can spend as much time. I'm not going to spend that much time now because I think the language in the regulation is pretty clear. So I'll walk through it, but then we can circle back at the end. We're saving time for questions, as I said, and we can talk about, the pinch points. Are you covered? Are your medical clinics covered? And what does that mean? So let's talk first about the scope and application of the ETS. As I said, the ETS applies to all settings where any employee provides healthcare services or healthcare support services unless one of the exceptions applies. And here's a list from the preamble to the standard on this slide that shows, what's covered, just typical facilities that are covered. Obviously, the wheelhouse coverage is hospitals and, nursing homes, those kind of facilities. However, if you look at the bullet we've highlighted, health clinics and manufacturing workplaces are covered. All right, so every one of your facilities is in. And this is a flow chart, and I'll talk about what in means, but anyone who's got a medical clinic, you are in unless you can get out. And getting out, there's a pretty big window that OSHA has built in this to get out. And I want you to clearly understand that. This flow chart that Vita has up on the screen now, this is from OSHA's guidance itself, and I'm not going to walk through it, but it's it's not that confusing. It's pretty clear. And I think it's going to show you what we're going to talk about next, which is the exemptions in the rule. So background is your medical facilities are covered. All right. What is, and you know what, Vita, let's go back 2 slides because I want to make sure everyone understands something. I think it's on this slide. Maybe not. I don't know where it is. But what you have to understand is your medical clinics are covered, but that doesn't pull all of your facility in. Meaning if you've got a medical clinic, but that's one of 17 buildings on your campus or 3 buildings, the only facility that's covered is the medical clinic itself, where healthcare is being provided. Here's the slide I was looking for. Okay, so the ETS applies to embedded healthcare settings within the industry, but not the remainder of the physical location. All right. And now let's talk about the exceptions to the standard. Okay. The 2 important exceptions for you guys, there are more exceptions, but we didn't include them in the slides because they're not that relevant to your industries. One is an exception for non-hospital outpatient settings where non-employees are screened for COVID symptoms and suspected or confirmed COVID cases are not permitted to enter. Okay, so 2 requirements that if you apply those requirements to your medical clinic, it now gets accepted and you're back outside the ETS. You're not covered by the ETS at all. All right, again, because this is pretty important. One is that all non-employees, meaning what that means is all your employees who are coming to the clinic, those people are screened before they come in the clinic for COVID symptoms. And I bet you guys are all doing screening anyway. So they're screened. And second, anyone who's got a COVID symptom does not enter the medical clinic. If that's the case, you're out of the ETS. Okay. The big question that raises is in red on this slide, which is if your medical clinics are providing care for your employees and for your employees' families, if they show up come cold and flu season, or right now in the middle of allergy season, if they have a stuffy nose, if they have a sore throat, if they have some issues with breathing, does that mean that they've got, a virus, strep throat, a cold, some sort of nagging cough, or COVID? Obviously, you don't know from those symptoms. You're going to have to make a tough choice as to whether you allow your medical clinic to be covered by the ETS, and we're going to talk now about what those requirements that you'd have to put in place are, or whether you stop seeing patients, your clinic stops seeing employees and their families who have those typical cold symptoms. That is a way to get out of the standard. And we're talking to OSHA about the quandary that puts companies like yours, because I know you'd like to provide that sort of common cold type coverage to your folks, but not if, maybe not at the expense of having to comply with the ETS. The second exception that we wanted to bring to your attention is the exception for first aid. Just because you guys have first aid trained employees, and I'm sure you have trained responders, a lot of you guys, If someone goes out onto the floor, the middle of the manufacturing facility, to administer first aid to an employee, if that person is not a licensed healthcare provider, that does not all of a sudden make you covered. That part of the facility is not covered just because you've got someone, a non-licensed healthcare provider providing first aid out on the floor. All right. We've talked about this. Now let me just tell you effective dates. Let's move. Because it's an emergency temporary standard, the effective date is July 6th for all provisions of the ETS except for a few. The physical barriers, the ventilation, and the training requirements. OSHA gives a little additional time till July 21st. But still, we're talking about next month. July is about to be here. So you've got basically about a week to get everything in place. And we're going to, again, run through what everything means for your medical clinics in just a minute. And then you've got a little extra time to develop the training materials, develop a gap analysis where, if you've already done training, and we'll talk about this, if you already done the other thing that OSHA has told us is, and told the world, is that they may well apply some discretion that they've got in terms of making enforcement decisions, inspecting, issuing citations, where employers are showing that they're making good faith efforts to comply with the standard, understand what it requires, get things in place, but you haven't quite got there yet. You don't have everything in place yet. I can guarantee you this agency is going to be fairly aggressive for those entities that don't move at all. But for those that are making good faith, I'm hoping that the agency will bring some reason to bear and use the discretion that they've got to, sort of hold off on enforcement. All right. Now, I'm going to run through, and as I said, I'm going to try to do this pretty quickly because one thing I don't know about your facilities, and that's why I'm looking forward to an actual dialogue here. Matt and I have talked some, but I don't know how many of you, I know most of your facilities, many of your facilities do have medical clinics, so you're going to be pulled in to the ETS, but I don't know how many are going to then try to opt out by, screening and not letting COVID people in. If that's a whole bunch of you, if 90% of you are not going to be covered, I don't want to waste, an hour of your time talking about the requirements of the ETS. So we're going to try to move through it pretty quickly, but again, we'll come back to it. Okay. Highlights of the ETS, most important requirements. A COVID plan. You need to, unless you have 10 or fewer employees company-wide, you need to have a written COVID-19 prevention plan. I don't know how many of you all already have those plans. I know if you were in California, you probably do. Some other states, but most of the country did not require a written plan until now. So you will have to have a written plan. The written plan, the predicate for a written plan is a workplace-specific hazard assessment. Basically, you have to look at this medical clinic, make determinations about where the exposures lie, where are the pinch points, where are the tough places where you think there's likely going to be transmission, if there's a COVID case where transmission will happen. That will be your hazard assessment, and then that gets built into this response plan, this written plan. Go back one second, Vita. You have to, in developing the plan, you've got to consult with non-managers. You guys can't just, management only do it. You've got to have some interface and interaction with your workers, your teammates. Make sure you get some information flowing upwards to make a development, to do your hazard assessment and make the plan. And this is a, dot the I and cross the T, but an important one. You've got to have a COVID-19 coordinator. Someone's got to be appointed at your company to be the person responsible for development of this plan and the implementation of the plan. So you've got to name a specific person, and that person has to understand their responsibilities. You have to outline in the plan a process for verifying employee vaccination status, because a lot of the requirements here are going to, not a lot, but some of the requirements of the ETS tie to whether you have a fully vaccinated workplace or who is vaccinated and who is not. Okay, moving on. The hazard assessment. You know, I've already explained. You've got to basically, it's common sense. You've got to identify where the hazards are, and then you've got to figure out, okay, how do I address those hazards? How do I mitigate, reduce, eliminate COVID exposures in these pinch point hazard places? The document itself should have this is the COVID plan and the hazard assessment that's included. It should date that when the hazard assessment occurred. All right, so OSHA's going to need to see, when did you do that? That's going to be your proof that you did in fact do it. The names and the titles of the people who actually perform the hazard assessment, and where those high risk areas are. What are the tasks? What are the areas where you think it's most likely transmission will occur, and what's your plan to deal with that? Okay. PPE. This is an important part of it. Face masks. Within the covered part of the facility, so let's say your medical clinic is in, you have got to ensure that face masks are used in that facility. Throughout that part of, the clinic, everybody's in face masks. Every employee's in face masks. You've got to provide those face masks. You've got to provide enough of those face masks that at least they can be changed at least once a day, or whenever they become, you need, because of the person's been dealing with someone who may have an infection that needs to change the mask. Okay, so at least once a day, or if it's soil damaged, or you need to change it because of patient care. There are some exceptions that are built into the standard for face masking. When you're alone in the room, if you have a doc, I don't know exactly what your clinics look like, but if you have a doc or a nurse's office that is closed and she's alone in there, or he's alone in there, all good, you can be without the face mask. Obviously, when people are eating and drinking. However, if that's the case, query, where do the people who work in your clinic go to eat and drink? Because those people are covered. So a respirator under 1910-134, then they obviously don't have to also wear a face mask. And then there are some other exceptions. If you have evidence to indicate that wearing a face mask presents a hazard to someone's health, because of maybe the situation with the heat, maybe, those of you guys in Alabama and it's 110 degrees out and wearing a face mask is just going to be too much, that's an exception. There are some, things you have to do if you apply that exception. That's an exception. Religious reasons, good faith, sincerely held religious reasons, medical disabilities. If there's someone who can't, who's deaf and you need to see they need to see someone's mouth when communicating. So there's some of those things built in. And also, as any portion of the medical clinic, and this is sort of a sub part of your clinic that is sort of separated, well-defined, and there's no reasonable expectation of a COVID person in there. Now, if there are no COVID people coming in anyway, you're not covered. So, I don't know if this is going to be helpful to you or not, but that is an exception. All right, Ita. Respirators and other PPE. There may be requirements that you guys have, separate and apart from COVID, where your guys have to wear 1910-134 respirators. If that's the case, then, you're good because you've been following the respirator protection plan. If you're putting your people in respirators in the clinic because of COVID, because COVID patients are coming in, you need to make sure that you understand the requirements of 1910-134 and that the main requirements are a written respiratory protection program. This is separate from your written COVID program. All the people wearing the respirators and respirators they're probably going to be N95s in your case, are medically evaluated before they wear the respirator to ensure that they can, in fact, wear, there's no medical reason precluding them from wearing medical respirators, and that they're fit tested, and that they're trained on care and maintenance of the respirator. OSHA does recognize that we may be seeing shortages again. And if so, the CDC strategy to optimize the supply of N95 respirators will remain in place and be available to you. So if you have short supplies, you know, there are ways to deal with that. I won't get into that now. And the other important thing to understand is it's not just face masking and respirators. There are requirements for gloves, isolation gowns, and eye or protective, you know, clothing and eye protection. Those are all part of the ETS. So for your medical clinic folks, they've got to be fully suited with the proper PPE. The mini respirator program. I think the way this would apply to your clinics is if you've got a clinician who wants to bring in their own respirator, then you have to allow them to bring it in. So if they want to bring it in because they only have to face mask because of the situation, you know, well-defined area, no COVID, they only have to wear a face mask under the ETS. However, they want to wear a higher protection. As an employer, you have to allow it, but you have to give them a specific notice. It's actually, the words of that notice are in the regulation. I can give it to you guys if you need it. It's like Appendix D, if you're familiar with that, under 1910-134, if any of you guys do have respiratory protection programs. That's the main situation that would apply to you guys. The other time the mini respirator protection program applies is if, for your face mask people, if you allow N95s to be used, then you know, as a voluntary use situation. And again, I don't know if you're familiar with this, but if you do, then you've got to do certain things. You've got to provide training, and the training is listed here on the slide, and we can talk offline if this applies to anyone. And you have to ensure that a seal check is performed. One of the things that OSHA recognized in doing enforcement, you know, prior to this ETS all last year, is that a lot of employees did not have a proper seal check. They had proper respiratory protection, but they were not wearing it properly. It wasn't a fit test issue, it's seal check issue. So OSHA has doubled down on an employer's requirement to ensure a seal check. All right, Vita. That's just, we don't need to talk about that. Physical distancing. Let me just remind you, and you guys are probably all very familiar with this. I know your industry went through, you know, hell on this front because of the way you're set up. Physical distancing is part of the ETS. Same, nothing new here. Employees are required to be 6 feet apart where it's feasible. If it is not, if it is infeasible, and again, remember, we're talking ETS, so we're talking your medical clinics. So it's not always going to be feasible to be, 6 feet apart from a patient or someone else who is working with you on, someone who comes into the clinic. If you've got someone taking blood pressure and someone, doing whatever, if you've got 2 people there, they've got to be closer than 6 feet. And OSHA makes the allowance for infeasibility. So I think that's okay. They continue to include in the ETS some of these, requirements that I don't really think necessarily may work for you guys, but maybe some of them will. Staggered arrival, departure, staggered break times, reducing the number of people in a particular area, i.e. the medical clinic, doing telehealth, telework. I don't know if any of you guys tried to do telework on your medical clinics over the last year, but I'd be curious, how that worked, if it worked, and adjusting work procedures and workstations within your clinic so that they're further apart. Acceptance to the distancing requirements. If you have fully vaccinated employees, meaning everyone in your facility is in this clinic, let's say, is fully vaccinated, and there's no reasonable expectation of COVID coming in the door into that part of the facility, then you don't have to do the distancing. All right, physical barriers. I just want to do a time check real quick. Okay, I'm going to finish this up very quickly so we can talk about the guidance in California and then again have questions. Physical barriers. I think again, you guys probably know the drill here. Your industry segments of the meat packing industry really got hit here. I think a lot of physical barriers went up. Basically, what has to happen here is where you can't physically distance, you have to have clean and disposable barriers at these fixed work locations. The exceptions, again, in feasibility and in those well-defined areas where you have fully vaccinated people or where you're doing direct care to a person who comes into your clinic. Peter? You know, here's some additional information about the physical barriers, the size they have to be impermeable, basically plastic or acrylic partitions is what everyone's using. They have to be able to be cleaned and they have to be cleaned. You can't kind of drop the cleaning protocol. That's an important piece of this. Next slide. Ventilation. Basically, with regard to ventilation, the ETS requires that you provide indoor ventilation to the maximum extent possible with existing HVAC systems. Okay, so that was one of the big questions that everyone was wondering about. Are we going to have to, if you're covered, are you going to have to upgrade your HVAC system? The answer is no, you do not have to upgrade your HVAC system. However, you do have to look at number 3 on the 5 key ventilation requirements. You do have to install MERV 13 filters in your system if the filters are compatible with your existing system. So OSHA recognizes and is not requiring retrofits for MERV 13 filters. If MERV 13s don't work with your current system, you don't have to use MERV 13. However, you do have to use the highest level filtration system that is compatible with your existing HVAC system. A couple of other important things, and this is fairly simple stuff, but we're highly encouraging you to document this. This is not, documentation is not required of these things I'm about to talk about, but if you don't document it, it's going to be hard to prove. And this is where this is where the enforcement's going to come in on ventilation. It's going to be pretty easy to check if you have MERV 13s. What is going to be harder to know and check is, are they operating in accordance with the manufacturer's instruction and design specifications? Meaning, basically, are they functioning as they're supposed to function? We would recommend that you really, if your medical clinics are in, we would recommend that you, whatever building the medical clinic is housed in, that you actually get someone in from the manufacturer, an engineer who can come in and look at the system, make sure it is operating optimally, and have that invoice or documented so that you can prove to OSHA if they come to your door that this has happened. And then common sense stuff, maximizing the amount of outdoor air circulated through the system. The more air exchanges per hour, the better. You guys may be familiar with that study that was done in Germany on a meat packing facility where, the study authors attributed the COVID outbreak to the low number of air exchanges that happened per hour at that facility. So increasing the amount of outdoor air and the recirculation of air. All right, Vita. Cleaning and disinfection, nothing new here. Again, a lot of this ETS is pulling stuff that you guys are already familiar with in and now making it law. This is now the law. It's not CDC guidance, it's required. You have to have, readily accessible hand washing facilities. Or if you don't have to build hand washing facilities, but you've got to have the sanitizer, the 60% or above alcohol-based hand rub all over, have it everywhere. In the medical clinic, you've got to make sure that the medical devices and equipment are properly cared for. I'm sure your professionals are quite aware of how they have to be cleaned, how the medical devices have to be cleaned, and you just have to, follow the professional. They have to have the financial resources to make sure that they have the materials to do the proper cleaning. The COVID, oh, go back one second. The COVID equipment has to be dedicated. So if you're using medical equipment on someone who comes in who turns out to be COVID, that medical equipment has to be dedicated and cleaned before it can be used anywhere else. And then you have to do, obviously, typical sort of cleaning, regular cleaning and sanitizing. Next slide, Beta. Beta. Okay. All right. So I think what I want to do to save time, Beta, I don't know what number we're on here, but I really want to be able to get to the guidance. So I think we just maybe skip over the next few slides, health screening and medical management. Beta, why don't you talk about vaccinations and how about record keeping and reporting, and skip the rest so we can get on to Erin.
Yep, sounds good. Thank you, Kate, and nice to be here with you all. So for vaccination, the ETS provides that covered employers must provide to employees reasonable time during work hours to get vaccinated. And it does provide guidance on what reasonable time means. So that means registering for your vaccination appointment, completing pre-vaccination paperwork, travel to and from the vaccination site, receiving the shot, and then of course there's that usual that 15-minute period sort of after the vaccine, after you receive the vaccine, to be monitored. So it really is sort of an A to Z vaccination, reasonable time that it sort of encompasses the whole vaccine process. And then it says that paid leave can be done. Employers are allowed to put a reasonable cap on the amount of leave, and OSHA does have some guidance on specific numbers if that might help. So OSHA says it presumes that if an employer makes available to its employees 4 hours of paid leave for each dose of the vaccine, as well as up to 16 additional hours of leave for any side effects of the dose, then the employer would be sort of presumed to be in compliance with the requirement. So just some numbers there in case that's helpful. Just going to keep going by.
And Ashley, why don't you talk for a minute anyway about training? Because I think that's an important component of this.
Yeah, absolutely. So on to training. So there is, first and foremost, OSHA is really, I think you'll notice in its guidance to really hitting home that training must be in a language and at a literacy level that employees understand. So that language is in the ETS as well. Employers can offer training in a variety of formats. That includes online, virtual, instructor-led, or application-based training. But must ensure that employees comprehend the training materials and that they have this opportunity to get to ask questions. So there's this interactive, you'll see that sort of the first bullet says interactive training. And there are a number of topics that must be covered. And I'm sure many of you have already, trained your employees on these topics already. Sort of what is COVID-19, how it's transmitted, policies and procedures to prevent the spread, patient screening and management policies, tasks in the workplace that could result in infection. If you are a multi-employer setting, then those kind of workplace agreements, PPE policies, cleaning and disinfecting, health screening and medical management, sick leave policies, and the identity of a safety coordinator. So those are the topics that need to be covered. One thing that the ETS does allow, it does, I think, sort of give employers some relief in this regard, is that employers may rely on training completed before the effective date of the ETS. So as Kate mentioned, training goes into effect July 21st. To the extent that it meets the relevant training requirements. So if you've covered some of these topics, no need to do double duty. You'll just need to make sure that you do fill in the gaps. So if there's anything missing that you did not hit before, that you'll want to make sure to be in compliance by July 21st. And now on to record keeping. So a couple major requirements for covered employers is they'll need to maintain all versions. Well, first of all, covered employers, there is sort of this small employer carve out. So covered employers must have 10 or more employees across the entire company. That's who the record keeping requirements applies to. And covered employers must maintain all versions of their COVID-19 plan. And they must create and maintain a COVID-19 log. And this is sort of brand new. So this is separate and apart from your injury and illness record keeping. You're still maintaining your 300 log. Those are your work-related COVID-19 illnesses. The COVID-19 log is separate from that. And the major difference is you record every COVID-19 employee case on that COVID-19 log, regardless of whether or not the illness is work-related. So those are sort of, two logs, you'll need to be maintaining if you are under the ETS.
And if I could just interrupt here for a moment, Vita, we were disappointed at this requirement. We had advocated for taking the COVID cases off your 300 log entirely. There is the purpose of the log, the 300 log, as you all know, is it's a sort of a long-term trending analysis. You can identify where there are some hazards, where there are hazards in your workplace. If you see, patterns, that kind of thing. COVID is, God pray, a short-lived situation. We're going to have the pandemic behind us. I think we're already close to getting there, hopefully not to come back. So there's no long-term historical trends that need to be developed on your 300 log for COVID. So what we thought, but we also understand a need and a reason to keep all of those COVID cases listed. So we thought it made sense to have a separate log. It doesn't matter if it's work-related or whatever, just keep a log of everyone who has COVID. It doesn't imply anything about your workplace and the safety of your workplace. It's not on your log. It doesn't affect your rates, doesn't affect insurance, workers' comp. What ended up happening is OSHA actually did both, which is sort of the worst of all worlds. You've still got to keep track of these, do this very arduous and almost impossible to do well record work-related analysis to determine whether this particular case is a case of workplace COVID, meaning someone got it at the workplace. And if so, you record it on your OSHA log, but then you have to keep this separate log of everybody, regardless of whether they got it at the workplace. So just want to make clear, don't blame us, but we were trying to kind of lessen the burden, and it wasn't just us, obviously, lots of people were asking for this. But OSHA did not heed our advice, and these COVID cases still have to be recorded on your log. And Bita, I want, take your time on this. I was thinking we had till 2:30, till 2 o'clock, but now I remember we have till 2:30. So I kind of rushed there, but that's okay, because we can circle back on anything that is important. So I think we're doing okay on time. And go ahead, Bita.
Sure, sounds good. So yeah, just like Kate said, so this is a separate log, and these are just some of the requirements around this new COVID-19 log. You must include the case on the log within 24 hours of learning of the positive case. You must include information on whether the case was confirmed by a test, like a PCR or antigen, or if the case was diagnosed by a healthcare provider. You should not include any individuals on the log who exclusively telework. I think, OSHA recognizes that those are isolated cases, even though it is strange because there is no, factor in work relatedness in this COVID-19 log, but that is a carve out that they make. You must maintain the log as a confidential medical record. So you want to keep it separate and apart from your other documents that you keep in the normal course of business. And you must maintain and preserve the log for the period that the ETS is in effect. And additionally, you have to make it available to employees upon request by the next business day. And when we say making it available to employees, we also have in parentheses there in a very limited manner because there is specific information that you should include, but also specific information not include because obviously this is a confidential medical record. So moving on to reporting. And there have been a couple differences, key differences, I'd say, with respect to reporting COVID-19 cases. So, so traditionally, under your normal reporting rules, it's 1904-39 B6, employers are required to report a work-related fatality to OSHA only if the death occurs within 30 days of the work-related incident. Or for inpatient hospitalizations, only if the inpatient hospitalization occurs within 24 hours of the work-related incident. And I'm sure you all know this. So OSHA has actually changed that up quite a bit in its ETS. So under the ETS, those temporal limitations are gone. So what that means is employers are required to report each work-related COVID-19 fatality or inpatient hospitalization, regardless of the amount of time between the exposure to COVID-19 and the death or the inpatient hospitalization. Specifically, you must report each employee COVID-19 fatality to OSHA within 8 hours of learning about the fatality and each COVID-19 inpatient hospitalization within 24 hours of learning about the inpatient hospitalization. So those are definitely two rules covered employers should be well aware of, is that those temporal limitations under the normal reporting rules are gone. And then we also did want to note that if an employer reports a COVID-19 hospitalization to OSHA and that employee later dies, there's no need to make a second report of the more serious outcome. And this is actually going back to a letter of interpretation our firm helped develop. You'll see Kate McMahon's name on the letter of interpretation. And it really is just to affirm that there is no need for employers to do sort of double reporting. And then Kate, did you want to sort of go through patient management and screening, or I can go through these a little quicker. Oh, Kate, I think you're on mute.
Yeah, I think we probably don't need to talk about this now because I see there's at least one question about, coverage again. So if a lot of people are going to fall outside the ETS, we won't need to worry about that.
Sure.
And I think same with the standard and transmission precautions.
And these ones are pretty obvious too, anti-retaliation and no cost provision. So with that, I'll hand it over to Aaron. We'll discuss the updated COVID-19 guidance, which is for non-healthcare settings.
Thanks, Bita, and nice to meet everybody. Bita, if you can, yeah, thanks. My name is Aaron Gelb, and I am based in the firm's Chicago office, where I lead our Midwest OSHA practice. For those of you that are not covered, well, actually, yeah, it's going to apply to everyone that's listening, this part of the program. So whether or not you're covered by the ETS, this is the part that you really want to pay close attention to. And we find ourselves, at least from my perspective, in a very interesting point in the pandemic, right? Because we've been living for the past 16 months with fairly consistent expectations from OSHA, guidance that was issued early in the pandemic back in March of 2020. And then shortly within, I think, about 10 days of President Biden taking office in January of this year, OSHA issued updated guidance at the end of January that laid out its expectations regarding a number of aspects, really all aspects of your pandemic preparedness and response plan. And everything was moving along or fairly consistent and static until the CDC issued its I think surprising guidance on May 13th that really was kind of hit the reset button, and that was the guidance that acknowledged and advised that fully vaccinated people could essentially take off their masks and stop distancing. And the upshot and the real significance of that guidance is that, and for those of you that have either been through OSHA inspections relating to COVID-19 or have been tracking this issue very closely, and you know that there hasn't been an ETS and there still isn't an ETS emergency rule that applies to general industry. So what OSHA was doing throughout the pandemic was relying on the general duty clause, which I assume most of you are aware of, but for those of you that are not, the general duty clause is the section of the OSH Act. It's kind of the catch-all provision that enables the agency to issue citations to employers that it determines are not protecting their workers from recognized hazards that are likely to cause serious illness or injury or death. And so COVID-19 obviously, from the agency's perspective at least, satisfies that requirement that it is likely to cause serious illness or potentially death. And so if OSHA determines through the course of an inspection that the employer's COVID prevention program is deficient in some material aspects such that employees are exposed to that hazard, they can issue citations, and they have issued citations, not a lot, but certainly we've seen an increase in citations under the general duty clause in the past 5 months or so. There were a handful issued during the Trump administration, during the first year of the pandemic, including a small number to meat packing and processing plants. And so when I talk about an interesting point in the pandemic, now that the CDC has issued this guidance, I think there's this, as one client has put it in a conversation that I had with them, that there's this momentum that is gone. It's almost like hopping on a boulder in the middle of its process down the hill. It's not like we're slowly gaining momentum, but we went from wearing masks and distancing to it seemed like, at least where I live, to one weekend where it felt like the pandemic was over. And the challenge that place creates for a lot of employers is that your employees are doing one thing in their personal lives. They're going out to restaurants and bars again. Maybe they've always done that, but certainly more people are doing that. They're not wearing masks when they go into stores, when they go out and go to the ball game. And then when they show up at work, they're kind of expecting that it's going to be the same thing. And what I can tell you is that OSHA doesn't view the pandemic as being over, and that greater burden that was created by the general duty clause to protect your workers from this hazard is still there, but the duty is to protect now your unvaccinated workers from the COVID-19 hazard, because the CDC's guidance has essentially said that fully vaccinated employees are no longer at risk for serious illness or death. There is still the potential of breakthrough infections amongst fully vaccinated employees, but there are few, if any, instances of people who have been fully vaccinated who are being hospitalized or have died. And really, I think the only examples I've seen of that are people who, it turns out, were immunosuppressed, immunocompromised, so the vaccine did not work on them. So what that means is, when you're doing the sort of hazard assessments, if you're redoing it or updating your hazard assessment, which is certainly a good idea to do on a regular basis, your focus needs to be on making sure that you are still protecting your unvaccinated employees. And depending on where you operate, you may have a fairly high percentage of unvaccinated employees. Certain states and counties were seeing rates as low as 20 or 30%, which could mean that a majority of your workforce is still unvaccinated. And so this guidance is directing employers to focus on how to protect those people. You can in many cases exempt, or you don't have to concern yourself as much with the fully vaccinated employees. So that's really the thrust of the guidance from my perspective, is making sure that you still understand that the pandemic is out there, that people still need to be protected when they're at work. And I think we're going to be seeing some interesting trends in probably the next few weeks or months as this new Delta variant potentially takes hold in certain parts of the United States. And so I can assure you, based on the inspections that I've worked on with OSHA, that if the Delta variant is running through the jurisdiction, the area where you have a facility, if hospitalizations are going up, if the death rate is going up or the infection, the positivity rate is shooting up, that OSHA is going to mean business when they come in to do an inspection. And there is, some of you or many of you may have already heard this as well, OSHA issued in January, or earlier this spring, I apologize, a national emphasis program focused on COVID-19, which means that the agency, based on industry classifications, your NAICS code, that certain industries, in addition to healthcare, will be subject to programmed inspections, meaning that even if you're not the subject of a complaint, even if you don't report a COVID fatality to OSHA, that just based on your industry, that the hazards that are perceived in your industries, that OSHA may still show up and do an inspection just based on the industry in which you're operating, and that they will be then taking a look at all these aspects of your COVID-19 program. So with that, let's move on to the next slide, and we'll talk about some of the things that the guidance is recommending. And I think Kate touched on this briefly during her opening comments. This guidance is in essence, kind of, as we've described it, as almost as a backdoor attempt at rulemaking, because, and I've seen this in inspections that I've worked on, OSHA cites or references its own guidance when issuing citations. So even though this isn't technically a rule, if you're not following, or at least attempting to follow the guidance, obviously that increases the risk of receiving citations from the agency after an inspection. So some of the things that the agency is recommending, OSHA is recommending in this guidance, and some of this you'll see is similar to what Kate and Vita talked about with the ETS, to providing paid time off for your employees to get vaccinated, quarantining unvaccinated workers who experience a close contact, as well as those who are experiencing COVID symptoms or test positive. I think there's fairly obvious requirements. You know, much of this focus on vaccination that we've seen from CDC carries through in OSHA's updated guidance. So CDC's guidance, I think a big part of that was to encourage people to get vaccinated, and that follows through here in OSHA's guidance. The path to victory over the pandemic in the eyes of OSHA, CDC, and I think the administration writ large is vaccination. And we're seeing in states where the vaccination rates are very high, now the positivity rate is dropping below 1%. And so OSHA really wants to encourage employers to then encourage their employees to get vaccinated, to have whatever you can do to make it easier for them, again, whether it's paid time off, whether it's after they receive the shot, if they're having side effects, things like that. So again, focusing on your unvaccinated employees, what do you need to do? You need to make sure that they are still distancing from each other. You need to make sure that they are still wearing masks. I had one client ask me, can we put all of our unvaccinated employees in one section of the facility? I would say that's probably the exact opposite thing that you would want to do, because then you're putting all the people who might be transmitting the virus amongst each other into one area. But what you need to do is, if you have employees who are, that are not vaccinated, is to make sure, again, that they are still distancing from each other as much as feasible, and that they are still wearing masks. It's the same, again, similar to the ETS, you should still be training people on COVID-19, making sure they understand your policies and procedures. One of the things that many employers had been doing, which I see the emphasis kind of really falling back, which was pre-shift or pre-work screening. The focus really now, I think, after close to a year and a half of going through this, presumably most, if not everybody, can recognize the symptoms of COVID-19. I haven't seen federal OSHA, at least, really pushing that you need to continue the temperature checks and things like that before people come to work. Not saying you should discontinue it if you find that it's working. Certainly if you find that it is weeding out people who are coming to work symptomatic. But at a minimum, you need to make sure that your employees understand what your policy is as far as what they should do if they have any of the symptoms of COVID-19. That they presumably should not be coming to work, and what benefits are available to them, so they recognize that if they call off due to COVID symptoms, that they are not going to lose their job. You should also suggest that unvaccinated customers and guests as well wear face coverings. Similar to the ETS, although not as aggressive, there are recommendations with respect to ventilation. I think it's a fairly one that you can meet relatively easy as far as maintaining your existing ventilation system. There's a big focus on a couple of aspects of ventilation to the extent that you have the ability to increase the air exchange rates, to limit the amount of recirculated air. The more fresh air that you can introduce into your facility, the better. That has given that COVID is an airborne transmissible disease, that is shown to be one of the most effective ways, even depending on location and safety concerns. And in HVAC, if you can open large doors and really increase the amount of fresh air, that is generally a positive from the agency's viewpoint. Cleaning and disinfection has been a big expense, I know, for a number of our clients that have reported spending millions, certainly larger clients, millions of dollars on cleaning supplies and outside cleaning companies. I think both OSHA and CDC have recognized, and really the focus has shifted from surface to person transmission to person transmission. So you should still continue the routine cleaning, but this kind of enhanced, 4 to 6 times a day of cleaning high touch areas has largely fallen off. And really there's no longer an emphasis on disinfecting your workplaces, except if you have had a COVID positive person within the workplace within the last 24 hours, then the recommendation remains in place to disinfect the areas in which that person may have been, whether it's in the break or locker room, the lunchroom, or certainly their workstation and any equipment that they may have touched. Continue to record those cases on your logs. Kate and Vita talked about this, but only this year, unlike the ETS, which would apply to your employees that are providing any healthcare services. This is your standard 300 log where you're only recording those cases that you have determined are indeed work related. I think in many cases that is going to be a small number. Certainly you should go through that work related analysis, and if there are alternative explanations, you do not need to record that on your log. If you have any questions, that's something certainly to talk through. We're happy to talk through or work with your current counsel to make sure you're going through that analysis, that you're documenting that analysis. So if you're ever called on the carpet by OSHA to explain why a case is not recorded, that you have reasons that are documented and you can point to what you did to investigate that case. There are, of course, consistent with I think almost every federal law nowadays, there are anti-retaliation provisions in the guidance. The agency, OSHA, for example, recommends creating an anonymous complaint line, so your employees can raise concerns or ask questions or report things that may be of concern to them with respect to the COVID measures. I think you're probably going to see people that are reporting coworkers perhaps that are not wearing a mask, saying that this person is not in fact fully vaccinated. So I would expect those sorts of concerns to be raised as well. And then keep in mind also, far and away, the greatest number of citations that we've seen issued as a result or in connection with COVID-19 inspections conducted by OSHA are under the respiratory protection standard and the record keeping and reporting standards, not under the general duty clause. So if you have employees that are mandated to wear N95s or other respirators, whether for COVID or for other reasons, and in the course of the inspection, OSHA discovers that, then they're really going to take a deep dive into your respiratory protection program and evaluate those elements with respect to initial fit testing, annual fit testing, medical evaluations, training, and all that. So you want to make sure your respiratory protection program is buttoned up. As it happens, we did a webinar on respiratory protection earlier this year, so we'd be happy to send that to you all as well. So I think moving on to the next slide. As I said before, one of the core elements that we're all very familiar with, I think, and exhausted by at this point in the pandemic, physical, social, what I think started as social distancing is now referred to as physical distancing. This again, it remains a key part of a pandemic prevention or COVID prevention program. Again, for your unvaccinated employees, those that are fully vaccinated, and you confirm that, they can discontinue distancing, but those that are not should not. They need to continue doing that. Now, the guidance talks about things like telework and flexible hours and all that, which sounds well and good, and it applies to many workplaces. But a poultry processing plant, these types of facilities, we recognize that distancing is not, in many cases, not always feasible. In some cases, it may be impossible. I worked on an inspection last year with a pork processing plant, and there were some changes made to line speed and to the locations at which certain tasks were done. Certainly the butchering and processing of the meat, there were some changes that could be made, but there were other aspects where it was truly impossible and not at all feasible to make those changes. So you don't have to make those changes, in my view, if it's going to radically affect your operations. But what I think you then need to do is look at, as the last bullet point talks about, are the barriers. And the science, there are studies that I think raise questions about the efficacy of barriers. But I can tell you that OSHA is not persuaded or doesn't really seem to care too much about the various reports that I presented to them. They believe in barriers. They continue to recommend and in many cases insist in barriers. So in one inspection with a food processing facility that I worked on, that was it. They had to have barriers in there. And there are different kind of, I think, risks or issues associated with the way your workers are spaced out. If people are facing each other face to face, obviously placing some sort of barrier, even if it's plastic sheeting or like a shower curtain between them, so they're not breathing directly on each other throughout their shift. Then the other position that you typically see are workers working side by side. So just know that continues to remain a consideration. I know that the barriers, one of the, I think the biggest issues in your industry with barriers, of course, is the food safety, so that they have to be either cleanable, they not have the crevices in which bacteria or other dangerous substances can get caught. So I know many of my clients that have operations like yours have opted for kind of plastic sheeting or curtains that can be either removed and cleaned or replaced with new ones each day, because those hard plastic barriers would not be feasible from a food safety standpoint. But that is all something to consider also, and be able to discuss with OSHA to explain or justify the types of barriers or partitions that you decide to install or not to install in your workplace. So then on to the next slide, and what ties in directly then to your barriers and partitions that are face covers. So in those situations where employees cannot distance, and maybe barriers are not feasible, there are a number of locations in some of the meat processing plants that I've worked in where that is simply neither are feasible. So in that case, then the face covers become all the more important. There was a general duty citation issued to a auto parts manufacturer earlier this year by OSHA, where employees were working within 6 feet on the same piece of equipment throughout the entire shift without face covers. I think if the employer in that case had required face covers and still had the people working without partitions because they weren't feasible on this equipment and within 6 feet, I don't think that they would have been cited. So I think it was the combination of no barriers within 6 feet and no face covers that got that employer cited. So barrier or face coverings become particularly important for people, the unvaccinated employees who are working within 6 feet of each other, and also when there are no barriers present or feasible. So the guidance talks about the type of, you should obviously be providing these face coverings to your employees at no cost. They should be at least 2 layers of tightly woven fabric, such as a cotton. They should not have exhalation valves or vents on them. Keep in mind also that there are some requirements, and this is, I think, consistent with the ETS or exceptions for places or locations, work sites where there may be a greater risk to the employees, whether it's from heat illness or the straps. I know some of my manufacturing clients don't allow anything to be worn, like I even had to take my wedding ring off in a recent inspection, made sure I did not lose it and have to explain that to my wife. But all jewelry had to come off. So, I don't know, their face coverings were worn, but there may be reasons from a safety and ingoing nip point type concerns where face coverings may not be feasible. If that's the case, OSHA recommends that you consult with an occupational safety and health professional to evaluate what your options are as far as protecting your employees and ensuring that the face coverings don't present a hazard to them. So one thing to think about or to keep in mind then with respect to face coverings, and again, we know how I know some of my clients, particularly in your industries, have said if we don't relax or remove the face covering requirement, we're going to lose people. Like they simply do not want to wear these anymore. And so recognizing that there is that pressure, if you are going to allow your fully vaccinated employees to remove their face covers, then our recommendation is that you ascertain and document their status. It doesn't mean that you need to keep copies of their vaccination cards, and in fact, you don't even have to view the cards. That is one option. But generally, our recommendation is that you either have employees complete a self-attestation form in which they acknowledge they are fully vaccinated. Ideally, they provide the date that they became fully vaccinated, the manufacturer of the vaccine, in case there are any booster requirements that come into play, and have some sort of acknowledgement that says, I acknowledge and understand that if I provide false information regarding my vaccination status, that I'm subject to discipline up to and including termination. The other option, as I said, is you could ask your employees to show you a copy of their vaccination card and then create a log or a spreadsheet that reflects the same type of information. You do not have to, as I said, keep copies. And in fact, I recommend against that because then you're going to be subject to some fairly burdensome record retention requirements, which would be the duration of that individual's employment plus 30 years. And the reason that we recommend ascertaining and documenting status of fully vaccinated employees is if you have OSHA, it comes to your site and is doing an inspection and sees people walking around without face coverings. I don't believe that if the compliance officer asks, who are those people authorized to go without masks? And if your response is yes, we're on the honor system, we trust them. And I think the next question is going to be, so you don't know if they're fully vaccinated? You've made no effort to find out? No, I think that there are at least a number of area offices, regional offices that would recommend citations in those circumstances. So ideally, you would have some way to verify that someone walking around in your facility is fully without a mask, is fully vaccinated. Ideally, you would even be doing some sort of auditing, safety walks, just like you do with any other safety rules. So we had one client that added it to its quality assurance team's checklist each day. So they look at food safety issues, and then there was a line added to the chart that dealt with face covering compliance, and just that you can document that those audits are done on a daily basis, and you can figure out ways to provide the people that are doing that check with either a way to verify the names of the folks that have disclosed as fully vaccinated, or other ways that we'd be happy to discuss further offline if that would be helpful. So then moving on to ventilation. Again, just I think these are also consistent with much of what you find in the ETS. And I think a lot of this is just very basic common sense and just good practice generally, pandemic or not. So making sure that your HVAC system is operating in accordance with the manufacturer's design and specifications and instructions. Make sure you're doing its regular maintenance, regular inspections. As I said earlier, I think a few minutes ago, make sure that you're, to the extent you can, maximizing the amount of outdoor air. The more fresh air that you have, you can introduce into your facility, the better. Kate talked about this. If you can install MERV 13 filters, if it's feasible, it's recommended, but it's not required under the guidance. As I said, also, you can open windows and doors if that's feasible and does not pose a safety risk. Also, and I saw there was a question about the application of the ETS to offices or kind of corporate. I think what I assume are support areas that are not clinics, not hospital, not medical care. Those areas would not be covered under the ETS. They would be covered, however, under this guidance. And if you have people that are working in close proximity, I know one of my clients during one COVID-related inspection, OSHA was making or focusing a significant amount of time on the shipping and receiving area, where this client had 4 employees working within or two sets of two that were each about 4 feet apart. The compliance officer was very interested in that, took pictures, took measurements. Ultimately, they were satisfied simply with adding a $150 HEPA, a portable HEPA air filter into that area to further scrub the air in that room. As it happened, that client had upgraded its ventilation system. It had MERV 13 filters in the office area, so I think that helped as well. But that is another option, I think, in smaller spaces, meeting rooms, conference areas, break rooms. The use of these HEPA filters is something that OSHA views as an overall positive. So then moving on to the next slide, and I think this is obviously for you all of particular importance, is that there is an appendix to the guidance that focuses on what OSHA characterizes or refers to as high-risk workplaces. And it specifically calls out meat and poultry processing along with several other types of higher risk workplaces, general manufacturing, high volume retail, grocery stores, and seafood processing. And so within this guidance, there are a number of best practices that OSHA recommends that employers in your industry consider adopting or exploring. And if you look then, if we move to the last slide that I'm covering, again, many of these I assume are all things that you're very much familiar with, that you've probably been implemented more than a year ago, and you've been as much as possible using for the past 16 months or so. If you can continue to do them, certainly I think OSHA is going to be looking for that. These are sorts of things that they're going to be asking. Are you still staggering break times? Have you expanded break areas, created temporary break areas? A number of my clients, there's a vacant area in a warehouse, so they put out tables and chairs. They put partitions on those tables and chairs. Have you modified your restrooms, one-way hallways, things like that? Anything that enables employees to maintain, the unvaccinated employees to maintain that 6 feet of distance from each other. Certainly, if you have a large workforce and everybody has typically pre-pandemic came to work or left at the same time, and you had large groups of people kind of pooling at the time clocks, that's another area to focus on. We find that even this far into the pandemic, people still tend to actually pay attention to the signage on the floor, the posters. It just kind of is a helpful reminder to people. So I would leave those out there if you had them in place already, or even considering adding them particularly if you're going to be pulling away or changing certain things like discontinuing staggered break times. And again, focus on ventilation as well, and the proper spacing. So I think that given this appendix, if you are inspected by OSHA, that one of the 2 areas of focus from my perspective will be how your employees are spaced out and distanced, whether you have partitions, and whether you're still making sure you're still requiring and verifying the use of face coverings. So Kate, I think that's it for the guidance. I guess Beta, I don't know if you're going to talk about California now, so I'll turn it over to you.
1 minute, Beta, before you talk about California, because now I'm looking at the clock again, and now I think we've gotten ourselves a little behind. So I want to turn to Matt and ask you what would be most valuable if we've got a few minutes left. We have been answering the questions in the chat, so I think we've kind of covered most, although there's a really good question sitting there right now that I'd like to get to. But we also have, probably 10 minutes or so on Cal/OSHA ETS. So you tell us, how would you like us to use this precious time of your members?
Let's get into some of the questions, and we can just see if more questions come in, and then obviously the slides will be available too. For everyone as well. So, maybe you can give a quick recap too. Obviously, Some of the attendees may be aware that Cal Ocean recently made some changes based on what the federal ETS came out and said. So,
yeah, that sounds like a great idea, I think. Bita, without doing slides or looking at slides, why don't you just explain what recently Cal OSHA did, which is going to be a relief to the group, I think, and then we can talk about the questions.
Yeah, I can just, I'll just breeze through the slides really quickly as a guide, but won't go into too much detail. So first thing, one of the major changes is physical distancing requirements have been removed. The only places where that crops up is during an outbreak. Employers will need to consider whether it's necessary to implement physical distancing. And then for a major outbreak, then the employers would need to implement the physical distancing. On face coverings, we got a good exception. So under the revised ETS, fully vaccinated workers are not required to wear face masks. But obviously those who are not fully vaccinated will be required to continue to wear face masks while indoors or in vehicles with another person. And the exceptions from the previous version of the ETS and the revised version are pretty similar. Another part about this is this fully vaccinated. So obviously the ETS, the Cal OSHA revised ETS contemplates that employers will know about vaccination status and has built into the definition of fully vaccinated this documentation requirement. Fortunately, that does not mean that employers have to maintain the vaccine card. It's very similar to the ETS. I won't spend a lot of time on it, but it does track very closely to what we've sort of talked about before about documentation of vaccine status.
And I think, if I can interrupt there, Bita, because I really do think we're running low on time, and I think Matt would like to get some questions. I think you've now covered the key thing, which is face coverings and vaccinations.
Yeah, and I'd say the third is respirators.
Go ahead.
That is a big, I'd say, new requirement is that in California now, upon request, employers must provide respirators for voluntary use to employees who are not vaccinated and who are working indoors or in a vehicle with more than one person. So I'd say that was sort of the other major part. Partitions are deleted. Exclusion pay basically stayed the same. Notice is tracking 86, 85 now, so a little bit more consistency there. And then, with the outbreaks and major outbreaks, I'd say they really incorporated the FAQs from the previous version of the ETS, and now they're sort of written into the revised ETS. But that's all I had, Kate, so.
Good, okay, excellent. Thank you for flying through that. And I'm sorry for those of you, who aren't as familiar with this. Obviously, Matt, we're here, we can help, we can get on the phone separately, but let me turn it over to you and what do you think, Matt, we should talk about in the few remaining questions?
We can answer some of the questions. Again, I want to remind everybody, if you have questions for the panelists, please use the chat window. Just type in your question and we'll read them to the panelists. And I want to thank the panelists for answering some of the questions as they came in. We had a couple here in the people put in the Q&A area. If a site is strictly administrative support, I think you answered that question, but does not have Aaron to answer that question. If it does not apply, what standards or guidelines will we govern the COVID? I guess you said, as Aaron said, the guidance would apply to a strictly administrative environment.
That's right. Exactly. Go ahead, Aaron.
Yeah. So your office, and basically, as I said, any non-healthcare setting is going to be subject to, or OSHA would be looking at and evaluating your compliance with the guidance for general industry that was updated on June 10th.
Okay, let's get to the chat window. I think we'll answer some of the questions here that haven't been answered. Lori submitted one that says, how do we manage a program where the unvaccinated worker takes off her mask, but It doesn't, especially in our industry where employees wear protective clothing that can sometimes make it challenging to identify who they are at a glance. I am assuming that expectation of OSHA is that we must ensure that the unvaccinated worker is wearing a mask in order to protect them. As the guidance states, we all have seen what happens when it's left up to the honor system, such as local stores have done with their general public. It's better to have everyone to continue to wear masks to avoid this potential problem.
Yeah, so you know what, Aaron, you were about to say something, so I have a little vignette, but you go ahead first.
Yeah, sure. Yeah, I definitely don't think that I mean, I can understand why some employers might just say it's easier just to require everyone to wear masks, particularly if you have those challenges posed by PPE or other equipment that make it difficult to identify who's who. But I think I don't think OSHA would expect that. And if you look at it from a perspective of incentivizing or motivating people to get vaccinated, that would probably be a big disincentive to get vaccinated if the main thing that they wanted to do, take their mask off at work, was no longer an option. So I don't think you have to do that. Again, recognize you may find it easier. But there are, I think it's trying to find some approach or system that will work for you, enable you to determine and identify who is vaccinated, who is not vaccinated. We have had several clients that have approached us or asked us about, the sort of sticker on the helmet, different colored helmet or something like that. Obviously, that poses a number of issues, both from, I think, a potential controversy. Employees may take offense to that, but there are ways, I think, that you can kind of craft a message, and that it's essentially people that are authorized to take off their masks, that they have submitted proof of vaccination, they have chosen to take off their masks, but you're also clarifying that not everybody who is fully vaccinated has chosen to take their mask off. So I think there are ways to kind of, in other words, characterize the people that have that kind of marking on their clothing or their PPE, that it is not a strict identifier of who's vaccinated and who's not vaccinated. Because I think that's probably the thing that generates the most controversy. If you're specifically saying, everybody who's vaccinated wears this and everybody who's not vaccinated wears this, as opposed to saying people who are authorized to remove their masks, who have satisfied criteria of providing proof of their vaccination status. It's been documented. They've notified us that they wish to remove their masks. They've been authorized to remove their masks. That's how these people then are so indicated by, again, a sticker or a helmet or something like that.
And I guess to add to that, Aaron, a question that just came in is, will it be mandatory to determine the exact numbers or provide those numbers to OSHA upon an inspection?
No, I don't think so. I think the one particularly, even though I again have consistently advised against going on the honor system, certainly one way to, if that is the option that you choose, you're willing to take that risk. I think you need to be very cognizant of whether you've done surveys or, I know a number of my clients have at least done kind of straw polls with their workers to find out how many people intended to get vaccinated even before the vaccine was in full rollout. Or if you're in a county or where 30%, 40% of the adults are vaccinated, and your general understanding is that your workforce is fairly representative of your county. If everybody is walking around without a face covering, I think that's going to be a problem. So no, you don't have to. I see no reason to believe that OSHA would ever expect you, if they show up to do an inspection, to have statistics on exactly who's vaccinated, who's not vaccinated. I think their main focus will be, are the people who we see on your plant floor without masks have you ascertained their status and have you documented it? Can you confirm that the person or the people we see without masks are indeed fully vaccinated? Because keep in mind, I'll shut up in 1 second. The last thing I just wanted to say, I saw there was the question that talked about, that the mask protects people. It's really about source control. I mean, that's right. That's what we've heard throughout the pandemic, that wearing the masks may provide some limited protections to the wearer, but the primary purpose is to prevent that wearer from spreading infected droplets if they are asymptomatic to other people.
And if I could just, and this has been said, but I'm saying it again because it's so important, I think, for your industry in particular. I think you guys will continue to be in the crosshairs for OSHA for some time here, unfortunately, and not because of any lack of effort that the people on the phone have made, I'm sure, but it's just where we are, right? So I think it's in particular important for your industry to recognize that even though this is just guidance, if you operate on an honor system only, meaning basically it's a free-for-all, we're telling you, here's the law, here's our policy. If you're fully vaccinated, you don't have to. If you're not, then you do have to wear a face mask. If you do nothing more than that, I think you will see a general duty clause violation sooner or later in this industry. So at minimum, some sort of, even if it's a log of your employees with a check yes, check no, and the date, that's going to protect you.
And that's a good question, Kate. And then I think a question popped up, around maintaining these records or questions and HIPAA violations. I think there's a lot of apprehension around, the records, as Aaron said, length of employment plus 30 years, the question behind that.
Yeah. So, so there's a middle ground, I think. And there's a couple of different ways to do this. Honor system is on the far, right, and it's not recommended by us. And keeping a copy of the vaccination card is the furthest, the other direction. That's also not recommended by us for the very reason you've just identified, because that would in fact trigger 1910-1020, which is OSHA's medical record retention requirement. And as you said, and we said in the chat there, that's 30 years plus the time of, employment. So that's a long time to have to keep a record of that little card. So we don't think that's necessary. It would cause a huge burden for you guys administratively. Now asking to see it and then making your little check mark on your list of employees, that's a pretty easy thing. That document that you create with the check mark, yes or no for vaccinated, is not a medical record, would not be required to be retained under OSHA's 1910-1020 requirements.
Yeah, and I would just add to that while I prefer the self-attestation form because I like documents where if someone signs their name to it, it's harder for them to later claim that's not what they said. I think that if you are looking to strike a balance, maybe even something kind of less prescriptive than that, if it's part of your pre-shift screening process, you ask people or you go around in private conversations with HR or someone from senior management and ask each employee whether they're fully vaccinated and record their answers and explain to them that kind of honor system based off of that. But you still ascertain their status because having someone orally tell you they're fully vaccinated is really no different than them signing a self-attestation form. So for someone that doesn't want to get into forms of any sort, I think if you just create that one master list where you've asked each person to clarify their status, that would be sufficient.
Yeah.
All right.
And I think one point that Aaron just made, I do think it's probably important for those people who may have a medical issue or a sensitivity that has caused them to not be able to get vaccinated. I think being sensitive to not wanting this question be asked right on the floor, I think through HR or through some private, it's a 2-minute interaction, it shouldn't be a big meeting or anything like that, but a private discussion or interaction is probably a very good idea. All right, I think we've hit time. Again, I want to
thank Kate and Aaron and Beta very much for your presentation today. I want to stress everybody on the call to please submit any additional questions to you that you have to your associations, to me, and we'll make sure that Kate and Aaron and Beta get those and answer those. Again, we will have the presentation slides after this event available, as well as a recording for those that were unable to attend. And again, I want to thank you all for attending and thank our panelists again for your participation today.
Thank you all.
Thank you. It was our pleasure.
Bye-bye. Stay safe. Good luck.
Thank you, everybody.
Bye.